Look at this question now. Asked in anatomy theory final exam. Describe the anatomical basis for performing lumbar puncture at L3 or L4 spinous levels. So, why will you put the needle between L3 and L4? Why will you do a lumbar puncture here? Okay, what is the anatomical basis? Why you are doing lumbar puncture? That they are not asking, right? So, the answer here is that the spinal cord is there in the vertebral canal, correct? So, at L1 level, you have what is called as the conus medullaris. The part of the vertebral canal formed by the first lumbar vertebrae contains the conus medullaris. You want to avoid this. So, what they are doing, let me zoom this picture. So, here you can draw diagram also if possible. So, your spinal cord is there in your vertebral canal. At L1, what you have is the conus medullaris, and then you have the chorda equina. So they want to avoid damage to conus medullaris or the spinal cord, you can say. So they are saying that you can puncture between L3 and L4. You can see the needle here. Okay. Some people say between L4 and L5 also you can put. Okay. But mainly if you want to say according to this question that I have asked, they've said interspinous process L3, L4. Okay. So this is what you have to explain. The vertebral canal formed by the first lumbar vertebra, that is L1, contains the conus medullaris. Okay, so you're doing lumbar puncture between L3 and L4 interspinous process, which is the spine. This is the spine between the spines of this vertebrae. Interspinous processes of this L3, L4, you will put the needle for lumbar puncture. They didn't ask why you're doing lumbar puncture. That can be many reasons, either to relieve the pressure or to retrieve some CSF, etc. for examination, right?